I'm Emily Gray and I'm from Motueka and I'm here at the Stoke Vets to see what it takes to be a vet nurse.
Emily is going to join two Nelson veterinary teams, one based at Richmond and the other here at Stoke Vets.
Hi Emily.
Hi there.
I heard you're interested in having a career in vet nursing.
I am, yep.
Wonderful, that's great. We'll give you a show around and see what we can do with you today.
Yep.
Thanks.
Donna Lindquist has worked at Stoke Vets as a vet nurse for 5 years. This veterinary practice mainly deals with domestic pets, mostly dogs and cats.
Basically, vets cut and we do everything in between. Vet nurses, they seem to see the animal from start to finish, see them recover, send them off home and deal with the clients after home as well.
And the job is very varied.
It can be from dealing with clients, doing nurses consults, getting your hands dirty, helping with surgery, scrubbing in, taking radiographs, doing cytology. It's huge. It's one of those jobs that every day is something different.
This is Cody, who's in for desexing. It's a very routine operation which involves a full anaesthetic.
Sounds normal to me.
After a pre-med checkup, Cody gets a tranquilising shot.
A little injection, and that's it. What a brave puppy.
One of the side effects of the sedative is the dog is likely to vomit and poo. It's the job of a vet nurse to clean it up.
They need to have a lot of initiative. It is really important. You need to be able to sort of hit the ground running. It's a busy job. What we're looking at here is his heart rate.
Oh, yeah.
And his oxygen saturation. And so we've got a blood pressure here as well of 98. So anything above 90 is what we want to see. So we don't want to see anything below 90. In the veterinary industry, you're really close-knit with the vets, your support staff and the nurses and all that kind of stuff. So it's a collaborative thing that we all have to work well together. This is probably the most dangerous period of an animal's anaesthetic. Is the recovery phase, so we need to still monitor them really vigilantly.
Yeah.
When we do routine surgeries and things like that, they bounce back hugely. They're up and about, they're fine to go home and they're happy. So we're going to give them some pain relief. So this is the dog equivalent of our Voltaren or Nurofen.
Yeah.
That's it.
Quite far.
No, that's plenty. Just onto his tongue's perfect.
Good boy.
What a good boy.
Cody will soon be good to go. Heading in today for a checkup is DJ. He's overweight and on a long-term program to get his size down.
7.58, so he was 7.8 kilos last time. So that's really good. So we're still continuing to lose the weight that we want to. Yeah. But this is a long-term progress. We don't want to make them lose weight too quickly. What a star, DJ.
A prescription food high in nutrients but low in calories is being used to sustain weight loss.
It is nice, you know, he's on a really good quality food and it's a little bit like having a nice whole grain sandwich opposed to some takeaway burger. It makes you feel fuller for longer.
And this is Dylan, who seems to have made a dog's dinner of his cage.
Out you come, Dylan.
He has really shredded that up, hasn't he?
You've got to be able to get down and dirty when you need to be. Sometimes it can get a bit messy. It's one of those jobs that every day is a different day. It's not the same thing every day. You never get bored. There's always something to do. And it's nice to be able to see that you're making a difference with animals.
A vet nurse will do lab work too. It might be preparing a swab from a cat's infected ear or a urine test for a diabetic dog.
You see anything strange in the abdomen?
You see a spine here.
Yep, that's spine.
And a baby spine.
A baby spine. So we've got a mummy dog and we've got one puppy. We all love animals, that's why we work with them, so it's nice when we can help them and it's lovely when you can see a happy client with a happy pet at the end of the day.
Next day, Emily's headed out to join the team at Richmond's Town and Country Vets. The practice looks after larger farm animals, cows, pigs and horses too. Emily's first job is a fecal egg count for a deer farm nearby. The test will decide if treatment is needed for worms.
This is the lab area, Emily, where we'll do the fecal egg count.
With a sample of deer poo, Emily teams up with vet nurse Annette McFadgen, who will show her how it's done.
Sometimes you'll get 25 of these to do and it's just non-stop.
Yeah.
We need to know quite a bit about the large animal side of things. We do get goats, pigs, alpaca, llamas and things that all do come in the back. We've had a miniature horse out the back that had to have surgery.
I can see something moving around.
Can you?
Yeah.
Oh, yeah, you've actually got a worm. That's not what we're looking for. We're looking for the eggs. This one's out of its egg already. So that's a larval stage. Goodness me.
They're tiny, aren't they?
Yep, they are tiny. Good one, keep going.
The deer will definitely need a drench. Out the back, there's an unusual arrival. Meet Rosie, a tame wallaby who has a jawbone infection. She's here for something rather rare in New Zealand, treatment in a hyperbaric oxygen chamber.
It helps to heal wounds about 15 times faster than they would normally heal.
Breathing oxygen at an increased pressure dissolves much more into the blood. This in turn promotes faster natural healing. It's a good additional treatment for problems like tissue damage or infection.
It keeps costs down, reduces the amount of antibiotics needed to be used, and the animals seem to like it as well. You coming out? Quite likes it in there, thank you very much. I might stay there. Oh, there she comes.
With Rosie on the road to recovery, Emily hits the road too. Off to the Beacon Hill Equine Clinic and another vet nurse to meet. Laurie Talbot loves horses and she'll be showing Emily another aspect of the job.
Got a mare that's come in and she had a big problem during foaling. The foal's legs came through the wrong hole basically when she was having the foal. So we're doing an examination of her today to determine the damage that was actually done, and we're going to have to do surgery early next week to fix that. So it's just to go through the extent of what the surgery is going to be.
I'm very pleased with what I see because it means that the surgical procedure is going to be relatively straightforward. I've had much worse than this. So that's good. So in terms of my examination today, I know now when I come back to surgery, I'm only going to need a modest amount of equipment, and that's fantastic.
I really love my job. Every day you come to work and you're not too sure what's going to be involved really, and we are really helping owners make great decisions for taking care of their pets, so yeah, it's very rewarding in that way. Emily's done a great job today. She showed definite skills with handling the horses, and she's definitely showing compassion for the animals, and yeah, I think she's got the goods to make an excellent vet nurse.
I was doing really good the last couple of days. We were at the clinic yesterday with dogs and cats and bouncing puppies, which was a lot of fun. I particularly like being outside with the large animals. It's definitely what I want to do next year, being a vet nurse.
You need to love animals. Vet nurse is a messy, often very dirty job. There are certificates and diplomas available in veterinary nursing, all with a variety of tasks and responsibilities. The qualifications available range from level 3 certificates to bachelor degrees. Entry requirements into these courses do vary, so check the website nzvna.org.nz for links to current course providers.
Supporting local content so you can see more of New Zealand on air.